Yes, good evening and welcome again to Girl Vibes. Every single Saturday at 6 p.m. we get to be right here on ETV Ghana, and we are live on HD Plus Decoder. Also, we are live on GoTV as well. So do call a friend to tell a friend that the Akufi Princess, Mercy V, is back on your set. Now, and then come on, I want you to know we are going to talk about depression, let me tell you, because our flyers are already out, our artworks are out already. If you've seen them, if you follow us on social media. And yabada nyame asesa ene yamba kukudama one ajunu mudoye papa ayen horrible chinkomo. But before that, no, let me go sip on my Verna mineral water, and when we come back we get to vibe right here. We'll be right back. All right, welcome back. You're watching Girl Vibes right here on ETV Ghana. And as I told you earlier, I have two intelligent, beautiful, very important ladies. Yes, with their field of job is very, very important and very necessary in the life of especially we the ladies. And today we are going to talk about depression, how to deal with it, and also how to overcome. And somebody may ask, depression, cry? I was in the cause depression. And we are fortunately enough, if you're watching ETV now, you're very fortunate because and then come on no mudo yepa. And if I for nafra would be if you know she's going through depression or and you as a crocodile depression here the crap for TV to her now and then come on to nimble very tight. So let me first of all introduce my beautiful ladies to you. I have with me, yes, the one and only Perfect Counselor, and she calls herself a Counselor Perfect. Echo social media assistant patch, or very active on social media. And how be her tagging on social media. And when it comes to TVs in Ghana, television be be. And in fact, Yami Juman, I think that there's our face in the corner through counseling. She's helping a lot of the youth. Counselor Akwaba.
Yeah.
I hope that suit the me,
Thank you.
You're actually wearing my favorite color, blue.
And you're also wearing my favorite. You have first change. I like red.
Let's just change it and set right now. Anyway, that's nice. I hope you're doing well.
I'm good.
We thank God. And I have a pastor here today, yes. I have a reverend here on set. She's Reverend Ivy Maria. Hello.
Hello.
Wow. Such a very young lady, and she being a reverend as well. I mean, how did that even happen?
I'm not young though.
Oh, well, then you're pretty.
I'm still young.
Then you're pretty. Trust me, then you're pretty. Because looking at the baby face, it's doing the magic for you. What more do you want us to know about you?
Okay, so Reverend Ave Maria, I'm a certified professional life coach.
Okay.
I have specialties in leadership coaching, pastoral coaching, and marriage coaching. And I'm also a midwifery officer. I'm a midwife.
Wow.
As well, yeah. And I'm also a cultural poet.
Okay.
So I do poetry for funerals and weddings.
Wow.
Yeah, so basically that's what I do.
Then please, on my wedding day, I'll come knocking at your door. And let's go to our counselor again, the only perfect counselor in Ghana. Yes. What more do you want us to know about you?
I'm perfect.
Okay.
Isabella Elom Kuma Odru. My husband is Odru. I'm married.
Okay. Oh, hello,
Yeah.
Mr.
Odru.
I had a call. The call came in. Thank you for doing that one for me. Okay, I really appreciate Mr. Odru. God bless you for you know it. So it's okay. There's no need for me to talk about it. Yeah. Wow.
Yeah. So the perfect is my name. It's not my Nikki. So like.
Oh, so the perfect is your name?
Yes.
Oh.
Yeah.
I thought it was
So
just
it's
a
like
title.
Counselor Barbara,
Okay.
Counselor AC. So
Okay.
I'm perfect. So I just added.
And you are perfect too. So the name perfect is perfectly working on you. No
God is
surprise, no tears
perfect.
about it. Now, on that perfect note, we get into the vibe right here. And today we are talking about depression. And I depression, I cry, not saying then. You see people talking a lot on social media. And the social media, no, I'm glad these beautiful ladies are here to help me talk to you today. Obia so Facebook Live now. Now, I'm depressed. I don't know as to whether depression now what kind of crash or in a cry. Maybe Perfect is here, she will help us, and our lady pastor too is here, she will help us. Hey, let me first of all go to our Perfect madam. Counselor, when we talk about depression,
Depression for the layman, I would say it's an emotional sickness.
Okay.
So you are sick with your emotions. How you are supposed to feel at the right time, you don't feel that. So it's the adverse. You have mood swings that prolongs for 2 weeks. So you become sad for no apparent reason for 2 weeks. You become happy with no apparent reason. There's no reason for it for 2 weeks. So if it's 2 weeks and more, it continues. So it deals with your emotion, how you feel. And being with somebody who is not being stable with emotions is quite stressful. So if I'm sad, I need to get out of my sadness, then I try to do other things, say things because I'm sad. You know, if you are sad, some drink, some try to hurt themselves, and if you are happy to, you can even give off your gifts and all that. So that is what is associated with depression. Depression is you being sick with your emotions. It makes my feeling. Odumribu oha, u feeling no chedanka, bibia nya obi enwi, obi ambro. Nanso na ho na abrabo idare ho democrats be beri ase be ye deni so hwa abrabo ma baby awrade di we fini baby odi wadwin e hwo mate mu kra na wo nan kai du baby nanso still na e hwo ho a enye you self worth yourself say, oh, I'm not worthy. By normal day no, you not feel that. So that is what depression is for the layman.
Depression now, we tend to just put the sad side, you know. There are a whole chain and depression. But I mean him there and you did crack until you decided there this topic may researching more about it there. You power when you do cry and send a depression. Madam Maria, Rev, did you know about that? Because I know you know, being a life coach, you know that one. But is it not surprising that me do cry no see sabi on your kid?
Okay, it's not surprising because I'm a nurse. Okay. So we deal with people with depression and Sisiano depression ababe to say normal lifestyle. Ababe mingle with their temperament. So a lot of people are depressed, but I'm categorizing them into temperament.
Okay.
So you find a lot of people doing some acts which we see as normal, but truly they are depressed. Yes. So it's really a broad topic, and it brings about a whole lot of issues. Even when you lose interest in something, it's a sign of depression. When you lose interest in eating 3 square meal, if you can afford, it's a sign of depression. It means you are going through something. If you are not able to smile, if you are not social enough, if you walk past people and you don't greet, they are all signs of depression. It's a very broad thing, and I think this platform is very good. It's making people know
the right information. Like what we're saying, if you lose interest in what you once enjoyed doing, so you used to greet.
Okay.
So who be on Chiani BM and Kawapan the body to me sit down and settle on. Then to see I want more back or they do some woman.
And they be me suspect today or depressed in Syria. Since I'm also learning in Syria, I mean, because Bia Nankasa Pono nim because she used to be very friendly and when you pack her now. To approach you, Messi B, how are you? But now, I thought we used to have, there's an issue between us, but I have no issues with her. But hey, I'm not saying, so people are actually complaining. So I think after this show, this discussion, this episode, I'll get close to her and then get to know about it. Because personally, I've been depressed before. Not long ago, it's been close to a month or so. So I was excited when my producer brought this topic up. Mengwa Jepa, and with the kind of guest and they was amnesi. Mengwa Jepa. In fact, say obichum wankasati. Obichum wo huna so touch you. Now we chill assist Sisiazi, able with the BB or Nipan. So it's about time you get closer and let the person know because obutuma bade, counselor, obutuma bade, obi I depressed. Nankasa ponyim do ye depressed.
Yes. So it's people around you who need to observe. In terms of, we all need each other.
Okay.
Nobody is an island.
Okay.
Into we here obi. So if I'm around, and depression is your types.
Okay.
Into obi or what ye de wono. A biological, a hereditary, ye de one genetic.
Okay.
Obi so a situational. And I'm an abanisa. Bibi is in a brabo. Into the wall ben no. I want to be in country say, but when we say the person is withdrawing, so you need to get closer. Once I so be as I say on penny pa or it's way janu. No, that is the time you need to get close to the person. Obon pa man asobekano. You also need to get close, freno.
Okay.
Sometimes a call can even stop somebody from committing suicide.
Counselor can send papa, but not robot types nibi. And to my member here life coach, none so on for types ne kaka on fan sword on my head.
Okay, as Counselor said, it be a situation now, it being so genetic,
Okay.
right? It being so it's me a year from manic episodes, right?
Okay.
It being so to me year from birth.
Wow.
Postpartum or postpartum depression obi o no ma or wuria or expect say obewo twins or wo ye no ba ko efiri mu. So like accepting the whole thing. Sometimes obetra scan no ye say ye be ma obewo no na ye oba ni kunu so say wan wo be ma mani nsi fie ho nya so obeja no. So it's a whole lot of issues types na there a dawson yentimi enkanina nyesa yenkomo ne yentimi endi but ye bobo kakra so now do you know that so obi ya ade na say o correct na wan accept ya nipa no you depressed ena say unim so say onso so de bia wo na hu the fault in others onso you depressed ana do you know?
It's a sign.
It's a sign of depression. It means that you are going through a phase that you think says you know it all, so you can correct. And the other person.
So the people we usually call them Mr. I know it all. They are not sometimes.
Yes. Once say mom we are so smart. I always say so be all artists so smart. On a name bibia or no correct you no. They mostly are hiding something. There's a weakness they are hiding. We all have our weaknesses. But if you leave yours to point your others nature say one can say there's something you don't want. Internet can say most activists somebody who is always activating about rape is not good. Nature say the person had an encounter experience obi obeka say oye homophobic those who are homosexual gay is either say the person is having that attraction, but or using a form of indirect to control it. And now say he has had an encounter. One say there's a lot that goes in our past and we exhibit it unknowingly. Until we try more a psychologist, you can assess people unknowingly, like say sometimes you realize most psychologists and counselors they are very calm. Because you see people and you empathize with them, say and you know the person don't or like it.
They don't have control
over what they do.
I researched on and I got to know some of the forms, and surprisingly, I got to know bipolar as one of them. I thought it was an ailment on its own without knowing it was part of depression. And before that, let's quickly go for a break.
Depression. Manic depression.
When we come back, as I told you earlier, we are going to have a very educative, as we've started already. Stick and stay. We'll be right back. All right, thank you for sticking with us, and we are back. But it was necessary that we go, and we are back. So, not here, because about bipolar. there it's part of depression. Please, we are also live on Facebook at ETV Ghana. And here no commenting in an pacho fatu homam na mebusa Counselor Perfect and I hen pastor tradition you my fe do go pacho or say weighing it but on so bring you know and come on my hot. And see bipolar and so eya abazo no cause and so.
And never be brave. And the bipolar eba. Obi ohonoma or withdraw from incorfor and from activity be or tire. Now feel waba be indoor person.
Okay.
And I say was shy away from ne friends. Inti a cost to aso. Obi ye ni bibia or onye easy to let go.
Okay.
Na or habo. Abuse, be our experience. It could be sexual abuse and domestic abuse and even verbal abuse. You say, social media cry. A lot of people are abusing people with their tweets and all that.
Comments especially.
Comments are there. Until obi inhaling then one day,
no explode.
Explode. You see when you manic episode. Until that's actually how it starts. Starting kakran. And if you are not able to speak to a counselor or a life coach or someone, and I only say most as a pastor, most of the people following us are depressed.
Yeah.
Yes, people are depressed because Obiu Wenebusim and God has revealed to you, say she's the next in line and Aneba the next in line. Into Odiwechi, not because say or Sumyami or the radio, Odiwechi because Osro. So most of the people following us are depressed, and most of us pastors too are depressed. Into your bar, Bible Munsem. Them preaching we and so be a idea bako in the church or by no de Bible preaching or exhibiting preaching to software or Timmy preaching or Bible net or Timmy preaching ne be an obi onu de be obi na ye ni bibi onu de be obi na betrayal. There's a problem.
I don't put interesting one. Now, I saw from no say a original Kwan and said, what's the down who do be Tanaza? And the sister they dressing no Gina Hobeka. Now, and some of Becca, it's all there directly no. I will not refer to Pacho also a depressed another one's it. One can wear who neck can or director.
Depression there and found so a pastor and now we on your pastor.
Okay.
It's me too be as I said, Pastor Ojina Kwan who the honor at sorry, they can go through something at Obiante. For example, I have this pastor friend that she was going through so much. Now, until me can't show Obia because people look up to her. People look up to her so much that everything about her, no, like Obia per se or Onyasa or no. So, like, how to even come out to say that this is what I'm going through, no. And I want to leave that thing, no, became a problem. And in Nyami Adom, she was able to finally leave. But Olivia, you know, it was a divorce. Divorce nisi, you know. And another depression set in because now Oba TV platform to talk about marriage, parading marriage and all that. And divorce and
comments that are coming from people.
Hey, if you can't hold your home,
don't come and talk or advise us.
And even some of the pastors stopped inviting her. And a lot of as of Mame for and a female pastors, they are going through so much in marriage and in their homes. But because of their society backcounting, they are dying slowly.
So it means we are rather causing the depression to people.
Yes.
But what I like to say here is everybody needs a counselor.
Even the counselor needs a counselor.
Yes, because me being a counselor, I have a co-counselor.
Yeah. Okay.
Because when you take a lot of issues on yourself, sometimes you also get depressed. Because if you hear a child who has been raped and all that, you end up the day, you go home and like, and you can't tell
After
anybody.
counseling people
Yes,
too.
yes, because you need to empathize with the person. Counseling is about empathizing.
Yeah.
So I put myself in your situation, I feel your pain, so that I'll be able to use the principles and the theories I've learned to help you. So if I take it upon myself and I'm feeling what you are feeling, so at the end, when you leave, I feel bad. So I need to call my co-counselor to also counsel me to distress.
Interesting.
Yes, that's what you do for it. Yeah, we all have that.
Yeah, each
Interesting.
Yes, yes.
Interesting.
So as a pastor, as you can, one thing is you must be careful who you talk to. But if you talk to a counselor, it's confidential. Everything is zipped. It's not going anywhere. And the bipolar, you see, I was talking about some people are born, the genetics, they had it through, so they have depression.
Okay.
And situation also can land you to have depression. But the severe form of depression is the bipolar. So if you have depression and you don't treat it, if it becomes severe, they give you drugs.
Okay.
You go to a hospital, they are going to prescribe drugs for you, and it's also having side effects. Like sometimes your mouth, you have halitosis and your libido gets down and all that. So the severe form of depression is the bipolar. So they have the manic episode. The manic is when it's high.
Okay. The
So when
elevations are now high.
Yes. So when they are too happy, the person can go naked and all that. So it depends. Maybe the person is nudity. The person can go naked. Somebody using profane words.
Okay,
Somebody
Joanno,
drinking.
Now we have one lady who is an advocate for bipolar that we all know, Abena Koko. I mean, she's been going through a lot that we normally see on social media. And I'm glad you're opening up to us today. Perfect. And Maria, you're doing us good today, because there are a lot of people that are doubting her. And recent ones are, sis your bandit, she goes extreme. One was an naked video, no, that. So, and then you see people bashing her instead of, bringing her closer, or even taking her to a psychologist, a counselor, or something like that. And some even media people do it. And they sit on their networks and bash this lady, bash her. But can't somebody that has bipolar also intentionally do some things to, lie to people that he or she is having, what do you call it? I don't know how.
Yeah,
the
it's
term
having
we
the
use for
disorder,
the
but
disorder.
the person is not. You see, people are using a lot of sickness to gain. And we have a name that we call them histrionic personality disorder, those who want attention. So they'll do anything for attention. It's also a disorder. So if we're not a bipolar and you decide to act like such, you are just histrionic personality disorder. That
to
is
just
what,
tell people you're having relapse.
yes, you get it. But sometimes you see, nobody will try to do something without the cause. So if the person is that and you are close to them, you must know that if the person is going through episode, you need to talk to them.
Okay.
When they shield you, still you need to get to them, you need to talk to them. So they need to open up to somebody. If they are opening up to you, they will not do what they intend to do, because they will be informing you about what is going on. You understand? And if somebody goes nude and somebody drinks, somebody insults and all that, it's the post-traumatic stress disorder that the person has gone through. So the person will act that way. If I've been raped before and that is what is in my mind, I don't really put much value on myself. I just want love. I just want to go naked or want to have sex with people. You understand? So it's the disease. Sometimes it's the disorder. So we need to understand that we are all not the same. Some have mental issues, and having mental issue, it's normal. A lot of people are walking around, they are dressed nicely, but they are having it.
It's
So,
normal to
yes.
have mental issues.
Most people are having it. From the survey that came recently, most Ghanaians are having it. So if you have a mental issue, it's normal, but you need to seek the right information and deal with it, and we need each other. So if we have people who they become very happy, they decide to give up their properties.
Yeah.
Some also become sad, they decide to end up their lives and all that. But there's medication, so you need to be taking your medication. And they also have counselors. They have psychologists and therapists that they talk to them so that they'll be able to manage it for them. So if you see somebody going through that, and one thing is, if somebody is having depression and you are in love with the person, you should be careful, because they can love you and the next time they don't love you again, they're in love with somebody else. And your moi is the disease, yes. So they love you all right, but next time you ask them, do you love me? Say, no, you are not my type. I don't love you. On your no nekasa.
But how will you even know the person is depressed?
Yeah, so that is what you need to open up. Some people know they have been diagnosed. They have been diagnosed, but they will not tell you that this is what I have because of the stigma people put on mental health. But we should take away that stigma because it's something that we go through. In one point or the other, we have been depressed before, but just that it hasn't gone to the severe extreme for us to be bipolar and all that. And some people have mild form. So you see some people be Caribbean and you're saying bias no bofu you better the eyes of person saying yama.
And man I was say TVs were them ningina.
As some kids way be be cranny bofu I say onya anger fees as I come in so ne ho was so na kuma bo hu ni onya ne ho. You get it. It's our issue. It's not normal. Anything that is not normal, you need to see a psychiatrist, you need to see a therapist for them to help you.
Wow. And they say papa perfect. Obi beno na done deeply, just as you said. Na ni pano or you're depressed. How do you even tend to help the person if say ni pane nya aware first of all? So nya aware do you're depressed. Another, if just as you were saying earlier, the one diagnosing that, better not, I get close to the person for the person to accept the he or she is depressed.
I say, it's easy for you to assess people from afar. Maybe too, if you ask me to talk to you about myself, I might say a lot of things. But when you ask somebody close to me, or no bet me, I'm a vivid of how I am and how I ask in a mistake crime. So if somebody close to you be odo, it's me when yama traits be omo say so if I when ya made yanko a psychiatrist or yanko hospital no money analysis. One say they analyze you to see if you're having depression. So yanko share and share be oho. Bibi sa that we start counseling, we start taking medication to help. But one thing I always say is love covers all what? Evil. So what do be Bible say Reverend has saying to know love is long suffering, it's kind, it bears long, it doesn't take record of the bad. Into what do be you must the health should be your paramount. One saying check now I say bofu and that's what do I did share what home. But when you sit down to assess everything, you say this person really loves me. But something is not working. Instead of leaving the person, if you have the knowledge, rather help the person to come out of it. There was a depression, so go why they are into a form medication, so no. Ebe kakrano, it will have ebe do sometimes they don't remember things that much. Into do birthday na one kaya. Ebo wa na on kaya yes because of one of the symptoms and so
that was what happened to me.
Yes,
I almost lost myself. Not me kai she like me to me the next minute is gone. I was like, no, this is not me. Because me obi a mekaya I said papa epa your 100 years. But it was like I lost it. It was off totally for me. Me no because I see Mary Befere. So I was like, what is happening to me? Then, fortunately for me, Global Media Alliance for Medawasiate, my company did me a favor. I learned paying for counseling sessions are very expensive in Ghana, Madam Counselor.
Not so expensive.
Hey, the smile. Look, we will come to you, but I shall know before I ever call counselors no more no cry no. Hey, I'm gonna you gonna ba monchen and rev. Yeah, ba. Hey, I'm gonna come to na you banning when is it?
I always say that every pastor should do life coaching or counseling
it's important
as part of his or her ministry. Because if you are just a pastor there are some professional stuff that you wouldn't know. And then obekoso ma akwantre, but na nya akwantre na ye physical idea we say nipa no eye. So we have to really open up for new knowledge and school.
Okay.
Yes. Counselor Kasembi say long suffering. Nkofo bebre busy on sa long suffering no. And they are getting depressed each and every day. Ade a wo mu no wan kasa onim se emboa ba wo se long suffering ebeye me free my den nkofo beka but se uwu a nkofo na wo ferry omo se ube free mama mate wa asem no uwu a they are the same people who will tell you that wewu sebio enkwasi ewu anka wo se oni obi kasa mami o Nigeria yo wuye
o si maker no.
Oh yeah, people were talking a lot. Because so new because we won't say why? Because Sibia or kind of Bible no long suffering or see different. So we pastors should be able to let our people know that long suffering doesn't mean that if it's threatening your life, if it's threatening your mental health, if it's threatening your sanity, if it's threatening your emotions, you need to take care of yourself first before you can take care of your home. So if the home is rather becoming a threat to you, you have to seek counseling, or you have to seek comfort in a counselor or a life coach. It will really help.
On that note, let's go for a quick break. When we come back, I am down there, Reverend. She's not just a reverend; she's also a life coach. Into know and the education. No, then we are title for Stick and Stay. We'll be back. Back, and let's say a big thank you to Adonko Next Level Premium Energy Drink, Mr. And the Jumana brand na apebi na ezenya ahos in the back vitamins womb sister maka then the one water na zingin na men train no be special grandsana and traffic in more but na was and come in a can black and I was a label gold no was a label Next Level no who come 80 for her na also be entrepreneur on 020-489-8698 and at 059-2610-998. If I want to confuse princess say, so uska kakra on functional, you know, also be entrepreneur. But I say now, and we are talking about depression, how to overcome it. And since you are the young courses ne kakra, in fact, one my young there, it's a one when you did don't necessarily do cry na sabi. Bibi hall until a day to ben psychologist be counselor be also phobia to a life coach, not just sophobia software or your life coach. And there's of mammy or how am I who day and yes sophobia keke no mum near or your life coach and ameba and our counselor I'll be too. Now our direct way shape we have come yaka bipolar is the navy now see any years about how I also would offer be and now when you be you suffer from depression how you get to approach the person now I'm away who there oh baby how na sana wako said doctor ho said counselor ho now I diagnose one now yamba perfect because of my me akasa na year ko break now counselor say obi wo depression no cry you better than a diagnosing the crown where then why no. Do you have to go to the hospital or who do you go to? Is it straight to the counselor? Because I feel before you go to the counselor and the crown as a whole another counselor and who are not catch you.
Mostly no you say you are aware that there's something wrong. Not everything is normal. But you don't know exactly what's going on.
Okay.
Until you have psychology near when did this war to have the counselors, lay counselors.
Okay.
That is obi our any relationship. Uko sani pakono wa no other nimdiene wo ho obetimi abowa. Then we have the counseling psychologist. Counseling psychologist no ye wo mo ye mental health into your mental health, you'll be on your school and career counseling, or be so your relationship and marriage. Into be on your mental health, you know, that person can help you. Or be so a psychiatric, clinical psychologist, you can go to them. One thing is that if you go to any counselor and it's beyond the person, we refer.
Okay.
If I'm my client and I realize that maybe I can't handle it. My field is not that. I need to refer you to a different person, so we refer. Okay. So when you go to any person, the person is going to refer you. Even if you go to the hospital, they will refer you if the doctor can't do that psychological evaluation for you. Once it's questionnaires and they ask you questions.
Yes, you go through test.
Yes, so they give you questionnaires and when you answer, it will indicate that you have it or you don't. So sometimes when you see people and just conversations, you can, and you have that knowledge, you can pick 1, 2, 3 from their life story that, well, no, things are not going on well, but since we're not my clients, I can't do anything about it. I might just, Dr. Binan and Nkasa, that's all.
Okay.
So you need to go to a hospital, a doctor, you go to a counselor, they have, they can evaluate you with assessment questionnaires and all that. Then if it's severe form, then they refer you clinical psychologist, psychiatric, then they start giving you medication. So it's a prescribed medication, you can't just buy it from the pharmacy, prescribe it for you, so we take it and they monitor your progress.
Yeah, I remember with mine, at a point I had to stop drinking normal water and they were helping me with alkaline water. And it did me well.
You see, it's a hormonal thing, so they help you with the hormones and all that. And one other thing is, if you have depression too, there are activities that you can do to suppress it or to limit it. Because if you have depression, you can start with little. You are not so indoors. You do outdoors, and we are doing planting. So you can also plant. You see, gardening, doing the exercise, fresh air, and all that, getting you connected with nature helps a lot. So when you run and all that, also help to bring down the depression, the stress level, and everything that is in you. Having new hobbies, going to the gym to exercise, going out with your friends for parties and all that, it brings it down. But if you shut yourself in the room, it doesn't help. And certain type of music too.
Okay.
If you're a depressed person, you don't listen to them because it brings down your mood. So you must know the type of music even you listen to. And even some people, you don't associate with them. Me personally, there's some group of people I don't like associating with them because they are too negative. Okay. I don't like negativity. Yeah. So if I realize that the
negative energy,
I don't even some tests and some people for my own sanitary sake, I block most of those people. I don't like those energy. They always want to criticize.
Yeah.
Nothing good always comes from them. You must learn to praise.
Of course.
We are human beings, so if you praise me, I like to do more.
Of course.
You understand? But if you always want to criticize, so don't want the pepper be away me.
Oh, who be that?
Then be stay away for now.
What chop a block? And I said, please, you heard it from the counselor. So be out of depression. In fact, negativity never not does. Mon chop a blog at us.
Your phone, what was that?
For my told me for me the credit interesting. Pastor, say yaka adofo one is no. Na yembra se me nua bi before counselor Rebecca dey yenko hospital na yenko counselors ho no na yehu dey nipa no obi no. Se obi ben wo na nankasa na brabo no rebo no kra na adwene ba ne ho dey. Ebia she's going through depression. How do you monitor such person and how do you even help the person?
Okay. Yes, it's obi yare na onyanji ntum se oyare a untimi emboa no and untimi manedro. So the person has to admit that bibi ehano. Se nipa na admit ya there are strategies are yede coining around the situation till the person admits. Okay. Until they admit to say problem, then you can help. Okay. If you think that the problem too is higher than you, like counselor said, you refer. Yeah.
And then I'm going to accept because now I can a strategy be. And you be able to make a strategy corner. But crown. And the almost bar. No, you do more on the crowd. America, we just a layman, no.
Something is wrong. Okay, you know, before that na cry na was say ultimate steady nipa ne ho eda o good mood.
Okay.
Emu na pe ade bi a opepa na that day no ye ma no.
Okay.
Then with a low tone no shada bisa no about her life. Eh na say cry there. Oni mi ndi nkomo. And then na cause bibia ye fine. Eh me da me bon pa e ma pa me bon pa se nya me be ma bibia ye me dwen ho pa bibia be ye why bibia ni a o de ka che mu nua ne me kakan kakra e be fa. You know when you start saying these things no the person will now come to understand say oh you have her at heart into obe open up ni na ka obe kakakra acho into kakakra chewa na still na okay can some now we yet sometimes it take a whole month and sanipa naka sometimes 6 months and sanipa naka
even you don't no kra no ansha na nipa ko na dream ba so so wo ka say my birthday kra wa nka yo aso me no kan ye won san so nka ye dey say na say won nka ya asem ono so be aware say obi so ka bi wa bonten share me so no so the person becomes self aware so there's something going on into of course na then you suggest say oh then why don't we go to the hospital
people so how was sure is very difficult to them producer Rashida say bibi ho na ewa e be ka baby sana on kada obi so kra ho a ono nyem producer nezen e can the change kra na it's difficult for her to accept there is a nipa kan especially yan wana normally wo a watch your part and suddenly they catch you oh obi a won fi obi na why you enyim you know obi kra ho ma space ni and get to close then you even get to talk to her. What do you do, counselor? Do you have to just let her be?
No, some people it's yes, obi numedro emayarfo. But in life you must learn to be open. No matter what, no, you must learn
Rashida, learn to be open.
Intenyo bia no beka one say we have people.
My producer is like that too. We have people we like a messy. That ends it ends there. Now until you pressure her, Mr. Director John Rebecca, so what's the on there? Rashida,
you should be open. And openness, you have a level. It's just when you confined in. Once enter most Christians, no, as I'm trying to swear, okoye sweni moko swa kuno kan. Then you want to. It's a form of therapy. Okuna we ko swa. Yes, we ko suna wakana samache yesu emuni munifoma kono. Oya no ko dry didipe. I said, wait, be left. You understand? But you having somebody who is physically there to listen to you, it helps. So get yourself a counselor. Get yourself somebody you can confide in. Once so you must get somebody you confide in. If you are, you are too close up. It helps. You end up having mental health. Once a year, so we have people like that. Temperament, some temperaments are also prone to depression. Okay. You understand? Some temperaments, obu temperament they are one or no. Okay. Awusuo no, emani prone to depression. Obi are someone onya depression. They be ani sigo so. Obi obechia no.
But counselor, Mr. Power by depression or by?
No, it's because of what happened. Situational.
Okay. So mine was the situational one.
Obu onya situational krana. Like lyric people, they are very hot. Anger, they all want to see things that into one yard and just or your pay. Now I start here the day or na come you understand? Yes, and the introvert who shake when your anger feast.
Now feel free to
BP no benya stroke you don't do that. Calm yourself down. Area sooner yabano. We are there but how you exist the world. It's important. There's a lot of things that are out of your control. I always say if you have any adverse situation, just take in, breathe in, breathe out, breathe in, breathe out, calm yourself. Then think about it again. Still now when to me idea now. Sit down, think about it again, sleep over it. Rethink about it. When you'll be honest, I just talk to somebody because you can't just take everything in. How about everything? Once the more you do that, the more you tend to have this disorders and all that.
Now we have few minutes, but nkomo na ewie kra me pede ewie ni nyina so asana yakọ. Counselor, na Erica there be mo what friend Jesus ni image nation. Now na we sha. But there are some people too that believe in the traditional way. Obu and then go hospital da. Is there a way to treat depression traditionally?
So we see the herbs treated here.
Reverend who I just know.
What I know is the orthodox medicine.
Okay.
Because orthodox medicine, I know panetimi actually say obi was this form of depression. Your Bible Saul was having it.
Okay.
The first king of Israel, Saul, said the evil spirit come to torment him. It's depression. Into a David abons him to calm him down. Yes.
So it was even in the Bible.
Yes. It says Anna maybe calming people down using songs and one say lullaby. Say wutuma oba. The person sleep. Into those songs na ye cool no. That is the traditional way. But for medically, I know say the counseling therapy and the drugs help a lot. Now where soon no. I want to talk about a man or
what's a man you're depressed?
Yes, a man say we are twice more prone to depression than men. Because first one, udu puberty, a lot change, hormones SSA, menses eba. Before menses, your breast get tender, and ya obi nimna make I say kumasi kejeti aye prekana. But this time na kaka na ashishe no dey say word I dey me ya me so let me obi sam say eni asem say nya bibia
asem yes
me bofu me say nya sabe taken me bofu ni something you get it, and the cramps that comes with it and all that. Some people have the severe one and we call it premenstrual syndrome. Then the severe one is the PMDD.
Okay.
Right. It's severe. They feel like even killing themselves. Yes, we have that. It's the severe form of what mild one I experience. Into that one is there, and we have the postpartum annex kind. Say a woman, the person gets what depression. Out of it. Into urban anywhere you have your menopausal symptoms. Later about me can say me crano, me before, then me say, then the what you get it. Into a because of the hormonal change that we go through in life, we are prone to depression more than men. So Bema the one say
most of them cry mind. And obey okay. So
we also break your heart account. Now what
but a money being so I break your heart too. Money being so you're very calm and collected, but a money being so it's your working. I want to mean can't show especially men actually
usually know from the onset of your birth and you're banging out catch the banging is the main so and you're banging type mean so
it's in
so it looks like it's the other way around.
Yes. Type before
producing
that's what I say. You must close no. It doesn't help them. You must be open. Obi a one time because we easily share our issues. About problem be share so bema.
So don't you think one mom no depressed more? I think it's because they don't voice out.
From Shishemudi, am I more depressed than
more? But I think them being in phone because I want one casa to them busy day and they don't easily express feelings. Command is in no more. John, please, a minute, just a minute. But before we go, depression, how long does it last? And is there a way to prevent it?
Yes, there's a way to prevent it, and it doesn't have a specific duration.
Okay.
It depends on how fast the individual.
When it's 2 weeks and you have the stable emotion for 2 weeks and about 1 month, you are still not happy. You are still too happy. You need to seek
so then it means
and preventing it once the situations June looking at you get it.
Those people know
and some issues this year, especially
Director, 1 minute
Christians no. Yeah, say, hey, obi a woni nyame asem na usu.
Actually, na zo final words na za account because I'm very now.
Okay.
I'm the member director. Don't say 1 minute.
Okay, you have to allow the person to mourn. Tell them that it is okay to cry.
Because I remember
it's okay to mourn. But after mourning, pick yourself up.
It's part of
see your counselor or your pastor who is a counselor or a life coach. And please, my pastors, my colleagues, my fathers and mothers, my junior colleagues, please. Yama yeti munye wholesale. I had the issues ni preach it too much. So now people have decided to close up because obekache pastor and no yede be program yede be preachy on so ni ska dey call counselor na life coach na ye betia ne say wa committee suicide. So please let's learn from discussion way ye making sure say we have proven ourselves enough so nkofo betimi trust na yetimi so keep your confidentiality right sane be ya bibia ni a when they run to us first then we can
Reverend member no ko enti patcho you may invite to view I wanna counselor in patcho won come on here do
my last one mental health no it's important.
Okay,
and to say we are malaria you are sick, yes, and now you have fever, you go to the hospital. So emotionally if you are not feeling okay, go to the hospital. There's nothing to be shy about it. Baby now will be so there's nothing to be shy. So if you need to talk to somebody, open up and close the word drains. And
if you need to cry,
yes, Ghana lead your life. I'm Counselor Perfect. Can I put my number out?
Please do. Quick one.
I'm Counselor Perfect. I'm on all social medias, YouTube, Twitter, Instagram, and everything. IG. My number is 0243 28 37 84. 0243 28 37 84.
Okay, Counselor Perfect.
Okay, so on Instagram is I am Reverend Ave Maria. On Facebook is Ave Maria. My number is 0542 672 880. On 2nd July, we are meeting our pastors and church leaders. Every Christian, we are training you all to know how to open up to the right people. Not just being spiritual, but you also need to know some things, some realities. Come meet us at Nungwa Barrier Junction Mall.
Yeah. Me da say director, me da say that 1 minute. Yeah, me sure be Pato, Counselor Perfect in your social media. She's everywhere. Thank you, Counselor. And then I'm sure be there. You know, you may invite to be a Pato and bring my hand. Now, Reverend, so now we have also on your young lady, Debbie. And then 2 beautiful, intelligent ladies. What I'm doing with your brother and Casa. And I also say they kunja. Na it's not fear na train. Now before I go on so and the Saturday na me late presenter Dr. Khan Yekata lecture here better Olivia Otumu baby as this is the Messi the Coffee Princess. So that's follow more Instagram at Messi. That's it.